Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director. Today's Tuesday, June 29th, giving you the update from Albany Med. All right, Fred, let's jump into the first graph. Capital region, people in the hospitals of the 8 counties with COVID. You can almost not see the number. That's how small it is.
That's right.
It's 10. 10. Next graph here, admissions and discharges to the medical center. Now, the last 2 weeks we had some fun with this because it's binary.
That's right.
So the first week it translated into an F.
That's right.
And the next week it translated into an I.
That's right.
Now, I'm thinking the next one would be N. Wouldn't that be fitting? Fin, as
That's
in
right.
over. So here's the 7 numbers, and it's 1, 0, 0, 2, 1, 0, 1. Now, you and I were kind of debating over this. Is
Right.
2 a binary number? Someone's going to have to figure it out.
It's not, but 2 gets translated into a binary code.
All right, so
someone will figure that out.
Matt Surf, he's already typing.
Yep. Expect
all
my
right.
phone to go off in a minute.
Translation, morning census here on the campus, 6, 4 on the floor, 2 in the ICU, and 2 of those are no longer infectious. So really only 4
That's right.
were being treated for COVID.
So the inpatient volume across the whole region is just, it's really quite low.
Thank you, vaccine. All right, Fred, we talked about this last week. We talked about myocarditis. It has been in the press, whether or not there was any association between getting a vaccine, a certain age group, and the condition known as myocarditis, which is an inflammation of the heart muscle.
That's right. So it's an inflammation of the heart muscle, Dennis, like all kinds of inflammations that can happen in the body. It can be very mild, it can be more moderate, or it could actually be very severe. So the first thing to understand about this is the myocarditis that seems to be associated in the under 30 age group is very mild.
Okay.
In some cases, it's only detected by a small bump in heart enzymes, something we call troponin.
Okay.
So
should we talk about our experience here?
I was just going to say, go ahead.
Yeah, sure, wonderful. So we had 7 cases that had been reported up through various channels that we asked a couple content experts to really take a close look at. Dr. Sarah Elmendorf, who's our epidemiologist on this campus, and Dr. Adnan Bakar, who's both trained in pediatric critical care and pediatric cardiology.
That's right.
And so there's a lot of detail behind these numbers. I'll just give you a very high level. 7 cases reviewed, all of them presented in a window outside of vaccination or 2. In all cases, they presented with some degree of chest pain and maybe a couple other symptoms that could be associated with myocarditis.
That's right.
Low-grade fever, etc. So they all had some characteristics. All 7 of them did very well in the hospital. None of them had really adverse outcomes. All 7 of them discharged relatively quickly with very mild symptoms. What am I missing?
That's right. No, Dennis, you hit the nail on the head. They had some elements that go along with myocarditis, and so presumptive diagnosis of the myocarditis. Not all of them had all of the testing that would definitively show it.
So for people who don't know all about myocarditis, they may say, isn't this a very straightforward diagnosis? It's not really, right?
No, it's not.
So you might either need a biopsy of the muscle
That's right.
or a special MRI. So it's often a constellation of symptoms or lab tests that ultimately leads to the diagnosis. For people who are out there thinking, should I get my child vaccinated or not, the study that you're going to talk about, I think, will give you the answer.
So Dennis, this is obviously in the news nationally, and the CDC and the FDA have been accumulating cases. So they've actually done a very detailed analysis of almost 700 cases. And they presented that data to the advisory panel to make a determination about whether this was something of significant risk. Now, these cases, many of them had MRIs, which is kind of the gold standard for diagnosing particularly mild myocarditis, or the leaky enzyme, the troponin. Almost all of them presented with chest pain, maybe a little fever, some myalgias, aches and pains, those kinds of things. They all did extremely well. So this is really a mild syndrome that these kids had. Some of them were hospitalized, put on some medications, in and out quickly, those kinds of things. So here's what they found. Let's pop up this slide from the actual CDC meeting. What you see in front of you is what I would call the risk-benefit profile for 1 million doses of the vaccine in adolescent boys. So I think the slide that we have up there are the 12 to 15 age group. And so if you give that age group 1 million doses, you'll prevent 5,700 infections, 215 hospitalizations, 71 ICU hospitalizations, and 2 deaths.
Wow.
And the risk of myocarditis in that same group is about 60 kids will have myocarditis.
And those would be mild cases?
They're mild cases, self-limited, not causing any significant issues. So when you stack those two sets of numbers up, clearly the benefit of the vaccine far outweighs the risk.
All right, risk-benefit.
Always, we consider that always in medicine, right, Dennis?
For sure.
There's always risk in everything we do.
Excellent. Thank you very much, Fred. Let's shift gears to blood drive. You know, Fred, you and I are both blood donors. We've talked about that many times here. Often we're talking about it just as we come up to the day of, or even on the day of. But in this case, because of this urgent need for blood, we're calling it out early.
That's right. So we have a blood drive coming on July 13th. That's Tuesday. It'll be an F309.
Yep.
This is one of the 8 blood drives we're going to have this year. It's from noon to 6. You have to register ahead of time. It's critically important that we all contribute.
Yes.
So as you said, Dennis, you and I both give blood.
Oh, yes.
Do you know how many units you've given over the years?
15 in the last couple of years for sure.
So
More than
actually,
that, I'm
I
sure.
looked mine up.
Yes.
I've given 69 units of blood.
Incredible.
Most of that here at the medical
Incredible.
center. You know, we all, I think, have an obligation. If you ever think that you might need blood at some point in your life, go out there and donate now.
So let's fill every seat.
Every seat.
Every chair. All right, good.
And on the intranet, there's a link to all the other blood drives going around the capital region,
Good
going
point.
on in the capital region. So you can go there and look if the 13th isn't a good day for you. Give blood.
Great. Special announcement on the campus yesterday. I think everybody saw this, but we'll take a moment here today to reflect on that. Dr. Vince Verdile, our dean, announced that at the end of this year he would be retiring from his current position. I mean, obviously, you know, the dean is a remarkable individual, great leader on this campus, certainly my greatest mentor. I know Fred, obviously someone that, you know, you've worked very closely with, and we just want to celebrate him here for a couple seconds.
Absolutely. Vince is the epitome of the servant leader.
Yes.
My success or your success is of paramount importance to him as the leader within the college.
Second longest running dean of American colleges.
That's right.
He's been dean here for over 2 decades.
Yeah, 21 years coming up on it.
Thankfully for all of us, after he steps down from the current role of dean, he'll stay on as dean emeritus, playing a very significant role in a couple important efforts, and we'll talk more about that in the future. But congratulations to
Vince.
All right. Congratulations also to our Daisy Award winner, Cheryl Ryan. Cheryl recently was recognized, and I think we have not only some nice things about Cheryl, but Fred will describe where she works.
So she works at the Endoscopy Center in Niskayuna, our facility at 1769 Union Street, an institution that's been there now, I think, 5 years.
Yes.
So here's what the patient who nominated her had to say about Cheryl. And by the way, this patient's a nurse. I was alone, nervous, anxious, and generally not feeling well. Cheryl helped ease these feelings. She reassured me that I was getting great care and that I would be able to handle any outcome that my surgery may bring.
Okay.
Fantastic.
Doesn't get any better than that.
Yeah,
Congratulations.
thank you,
Yeah, Cheryl. Cinnamon buns on their way out to Niskayuna.
That's right, Cinnamon Buns in Niskayuna, Endoscopy and Minor Ambulatory Surgery Center.
All right, very good. Yesterday, 2 Eye Care Award winners. Obviously, these are the best among us. They represent compassion, accountability, respect, and engagement.
Yes.
And it's always great when we have a couple to recognize. Who's the first one?
So the first one was Michelle Unser.
Yes.
Michelle's been here 49 years.
Yes.
Just a fantastic run here at the Medical Center. She's an academic coordinator for a number of programs, including neurology. A real fixture, done a tremendous job here over the years.
That was amazing. And then Christina Soriano, who's been here 15 years. She's an information technologist in our lab. And it was very special because when she came down, her family came down with her and had her picture with her family. And she was, both of them were really very moving.
Congratulations.
To both. Fred, in anticipation of Thursday's video, I think we're going to talk a little bit about booster.
Yes.
And there's some literature, so I guess this is a teaser. about mRNA vaccines, Moderna, Pfizer, and whether or not a booster is likely. So,
It was a Nature article published yesterday, so more to come.
all right, Thursday it is. It's hot.
It is hot.
Stay cool.
Yeah, be careful out there. Drink plenty of fluids. Try not to spend too much time out in the heat.
Yeah, for sure. We'll be back again on Thursday. We ask that you once again, please take care of yourself, take care of each other, and we'll see you in 2 days.